these symptoms again.
Again, we haven't even started yet.
Probably because some obnoxious pinhead with an indecisive British accent keeps interrupting me. Want the symptoms or not?
Okay, the symptoms today are fasciitis, cold compression therapy, and upper respiratory tract infection.
That sounds like a tough one. Fasciitis could be linked to chronic inflammation.
I agree with Leslie, but it's not necessarily the only cause. Cold compression might suggest an injury or stress-related response.
And upper respiratory tract infection could mean a viral or bacterial issue.
I see what you're all saying, but I'm sticking to my diagnosis. This patient has SLC6A1 epileptic encephalopathy.
But Dr. Hawks, we didn't discuss that in our conversation.
Our conversation is happening now, and SLC6A1 epileptic encephalopathy is all the rage. Wake up, damn it.
And why would cold compression therapy and upper respiratory tract infection suggest this particular condition?
You're right. It's confusing, but maybe more context might help us.
All of you will perform a salpingectomy on the patient. It's risky, but trust me, it's the right treatment. Look, boss, I've been doing this for years, and I'm telling you that my patient has SLC6A1 epileptic encephalopathy.
I understand that, Hawks, but your history with SLC6A1 epileptic encephalopathy is not convincing me.
I've never had it, therefore you should trust me.
I mean, I don't trust your diagnosis because you've mistakenly diagnosed a patient who had diabetes with SLC6A1 epileptic encephalopathy.
Maybe you got the two confused, Tracy. When you take the two conditions and make a Venn diagram with them, you get two circles stacked on top of each other.
That doesn't make any sense.
It does if you're a doctor. In most cases with Venn diagrams, the two circles are spread enough apart to perfectly emulate the shape of an ass.
Oh, shut up.
I'm not talking about yours. Don't flatter yourself.
So it seems like we might have made a mistake with the salpingectomy procedure given the patient's current critical condition.
I've been saying that all along. Dr. Hawks insisted on performing the surgery despite my concerns about its potential risks for patients with SLC6A1 epileptic encephalopathy. We should have listened to me from the start.
Frank, in no period of time since starting work at this hospital have I agreed about everyone needing to listen to you. And I'm not going to start agreeing with you now either. You probably got us into this mess by listing a bunch of symptoms for a totally different patient.
Oh, well, that's not going to do us any fucking good.
No, it's not.
You stupid wastes of carbon. You almost killed her.
What's going on?
We did it, didn't we? We fixed her.
I know, right? She's fine now. Wasn't that great?
Great. You're delusional, you idiots. She had SLC6A1 epileptic encephalopathy, not needing the salpingectomy which you fuckwits decided to perform. So what if we fixed her? You gave her a false diagnosis and almost killed her in the process.
But Hawks, we thought...
You thought incorrectly. Actually, that's too generous. Thinking is none of you clowns' strong suit.
Yeah, I mean, it seemed like the best course of action at the time.
The hell it did. Now, get your asses back to work before you kill someone else with your incompetence.
What should we do then, Hawks?
We need a new diagnosis. What's the right one?
Yeah, I agree. We can't keep screwing up like this.
You're damn right you can't. Now get out of my life and try to diagnose something without killing her next time. Johnson, it's wonderful to see you here at lunch today.
Hi, Hawks. What's got you in a good mood today?
Nothing. Anyway, how are things going in oncology?
Things have been a bit chaotic lately, but we've managed to stabilize most of our patients.
That's great news. I'm glad to hear that. What about the new patient you mentioned earlier?
Oh, him. He was referred by Dr. Smith last week. He seems to be responding well to treatment so far.
Dr. Smith. Who's he? Are you just inventing new characters so you don't have to admit that you advertise your services in Craigslist like some sad alleyway doctor?
Hey, just because you don't socialize with fellow human beings on this planet doesn't mean...
Wait, that's it.
What's it?
Gotta go, my patient is on the operating table, no thanks to you. I don't have time for your petty rules right now. I've solved the case, just let me do my job.
God damn it, you can't just walk in here like this, Hawks. We need to be wearing our personal protective equipment at all times.
I don't care about your procedures. SLC6A1 epileptic encephalopathy was wrong, and I figured out what the real problem is. It's infantile myofibromatosis.
And you solved this in lunch with Dr. Johnson? How did you manage to diagnose a condition like that over food?
It's not just about when you are, where you sleep, or who you're eating. It's about the mind and determination. And yes, I've diagnosed infantile myofibromatosis.
And the prognosis for this new diagnosis?
What kind of prognosis can we expect from this new condition?
Let me tell you, it's not as good as the egg salad sandwich I got on clearance at the gas station this morning.
So, Hawks, clocking out early. What about that case with SLC6A1 epileptic encephalopathy?
Dr. Frank got that wrong. It was infantile myofibromatosis.
I thought it was you who made the wrong diagnosis.
No, and I don't care for the false accusation. We have lawyers in this hospital.
And all of them are waiting for you to wreck their careers defending this place.
That's the spirit. See you in hell.